Your carotid arteries run up both sides of your neck, carrying blood from your heart to your brain. Place your fingers gently on either side of your windpipe and you can feel them pulsing with each heartbeat. These two arteries deliver approximately 80% of the blood your brain needs to survive. But here's what most people don't realize. Those arteries can become dangerously blocked without causing any obvious symptoms until it's too late. According to research from the American Stroke Association, approximately 15% of all strokes are caused by carotid artery disease. That's over 100,000 strokes every year in the United States alone. The blocked arteries in your neck silently cut off blood flow to your brain. When blood flow stops, brain cells start dying within minutes. The devastating part is that carotid artery blockages develop slowly over decades. Cholesterol, fat, and calcium gradually build up inside the artery walls, forming plaques. These plaques narrow the channel where blood flows. A severely blocked carotid artery might allow only a tiny trickle of blood through to your brain, or worse, a piece of plaque can break off and travel up to your brain, blocking a smaller artery and causing immediate stroke. But here's what shocked me when I researched this topic. Blocked carotid arteries often produce warning signs weeks or even months before a major stroke occurs. Your body sends signals that something is wrong. Blood flow to your brain is compromised. Small pieces of plaque may be breaking off and causing temporary symptoms. These warning signs represent your only chance to detect the blockages and get treatment before a devastating stroke destroys your brain. In this video, I'll reveal 10 warning signs of blocked carotid arteries that everyone over 65 needs to recognize. Number 5 is so subtle and occurs so briefly that people experience it repeatedly without ever connecting it to their neck arteries, missing the critical window for prevention. Before we start, I need to be crystal clear about something. This video is for educational awareness only. If you experience any of these symptoms, especially suddenly, seek immediate medical attention. Carotid artery disease can cause stroke without warning. Early detection and treatment can prevent catastrophic brain damage. Now, let's dive into the warning signs that could save your brain. Sign number 10. Sudden weakness or numbness on one side of your body. Starting with one of the most recognized warning signs, sudden weakness or numbness affecting one side of your body can indicate a blocked carotid artery is causing temporary brain ischemia. Here's why this happens. When a carotid artery becomes severely blocked, blood flow to the parts of your brain it supplies becomes inadequate, or a small piece of plaque can break off from the blockage and travel up into your brain, temporarily blocking a smaller artery before dissolving or moving along. This creates what doctors call a transient ischemic attack, or TIA, sometimes called a mini-stroke. During a TIA, part of your brain doesn't receive enough oxygen for a brief period. The affected brain region stops functioning normally. If the oxygen-deprived area controls movement or sensation for one side of your body, you experience sudden weakness or numbness on that side. You might notice your arm suddenly feels heavy and weak. Your hand can't grip objects properly. Things slip from your grasp without warning. Or your leg feels weak and unstable. You stumble when walking because your leg won't support your weight properly. Numbness might affect your face, making one side feel strange or tingly. Your smile might droop on one side. Research from the New England Journal of Medicine shows that TIAs precede approximately 15 to 20% of major strokes. Studies found that people who experienced TIA symptoms had a 10% risk of major stroke within 3 months if untreated. The mechanism involves temporary interruption of blood flow to specific brain regions. Your right carotid artery supplies the right side of your brain, which controls the left side of your body. Your left carotid artery supplies the left side of your brain, which controls the right side of your body. When one carotid artery is blocked and causes a TIA, symptoms appear on the opposite side of your body. What makes this warning sign critical is that it represents a medical emergency even if symptoms resolve quickly. A TIA is your brain's warning that a major stroke may be imminent. The same blocked artery that caused a temporary problem can cause permanent damage if a larger piece of plaque breaks off, or if the blockage completely cuts off blood flow. If you experience sudden weakness or numbness on one side of your body, even if it resolves within minutes, call emergency services immediately. Don't wait to see if it happens again. This is your warning to get urgent evaluation and treatment before a major stroke occurs. Sign number 9, sudden vision loss or blurred vision in one eye. Vision changes affecting just one eye can indicate a blocked carotid artery is sending small emboli to your eye. Here's why this happens. Each carotid artery gives off a branch called the ophthalmic artery that supplies blood to your eye. When plaque breaks off from a blocked carotid artery, small pieces can travel up this branch and temporarily block blood flow to your retina. You experience sudden vision loss in one eye. People describe it like a curtain or shade coming down over their vision. The vision dims or goes completely black in that eye for seconds to minutes. Then blood flow restores and vision returns to normal. This is called amaurosis fugax, Latin for fleeting blindness. Or you might experience sudden blurred vision, distortion, or a gray area in your visual field affecting only one eye. Covering the other eye confirms that the problem is isolated to one eye, not a problem in your brain affecting vision from both eyes. Research published in Stroke Journal found that amaurosis fugax is a strong predictor of carotid artery disease. Studies using ultrasound showed that approximately 60% of people experiencing sudden monocular vision loss had significant carotid artery stenosis on the same side. The mechanism involves emboli traveling from the carotid artery to your retinal arteries. These small pieces of plaque or clot temporarily block blood flow to your retina. Your retina needs constant oxygen to function. When blood flow stops, even briefly, vision fails. When the embolus moves along and blood flow resumes, vision returns. What makes vision loss particularly significant as a warning sign is that it indicates active plaque rupture and embolization. The blockage in your carotid artery is unstable. Pieces are breaking off. If a larger piece breaks off and travels to your brain instead of your eye, it will cause a stroke. Additionally, having vision symptoms from one carotid artery strongly suggests that artery has severe blockage requiring urgent treatment. If you experience sudden vision loss or changes affecting one eye, even if vision returns to normal quickly, this is a medical emergency. Don't dismiss it as a migraine or eye problem. Call emergency services immediately and get evaluated for carotid artery disease. Sign number 8, difficulty speaking or understanding speech suddenly. Sudden speech or language problems can indicate a blocked carotid artery is causing temporary ischemia in your brain's language centers. Here's why this happens. The left carotid artery supplies blood to the left side of your brain, where language centers are located in most people. When this artery is severely blocked or sends emboli to your brain, the language areas don't receive adequate oxygen. You might suddenly have trouble speaking. You know what you want to say, but can't form the words properly. Garbled speech comes out. Or you can't find the right words. You struggle to name common objects. You point at a cup, but can't retrieve the word cup. Or you suddenly can't understand what others are saying. You hear them speaking, but it sounds like a foreign language. The words don't make sense. These symptoms represent aphasia, impaired language function from brain dysfunction. Research from the American Heart Association found that sudden aphasia is a common presenting symptom of carotid artery TIAs. Studies showed that language symptoms appeared in approximately 20% of people experiencing TIAs from carotid disease. The mechanism involves temporary oxygen deprivation to language centers. The left hemisphere contains Broca's area for speech production and Wernicke's area for language comprehension. When blood flow from the left carotid artery is interrupted, these areas malfunction. What makes speech symptoms particularly alarming is that it indicates the blockage is affecting your dominant hemisphere, where critical functions are located. A major stroke in this territory can cause permanent inability to speak or understand language, devastating disabilities that eliminate independence. If you experience sudden difficulty speaking or understanding speech, even if it resolves quickly, call emergency services immediately. Don't assume it's tiredness or confusion. These symptoms demand urgent evaluation because they signal high stroke risk from carotid artery disease. Sign number 7. Sudden severe dizziness or loss of balance. Sudden dizziness or balance problems can indicate blocked carotid arteries are affecting blood flow to your cerebellum or brainstem. Here's why this happens. While the carotid arteries primarily supply the front and middle portions of your brain, they connect to other vessels in the circle of Willis. When carotid arteries are severely blocked, blood flow patterns throughout your brain become disturbed. This can affect the posterior circulation supplying your cerebellum and brainstem, regions controlling balance and coordination. You experience sudden, severe dizziness. The room spins around you. You feel like you're on a boat in rough seas. This is called vertigo. Or you feel lightheaded and unsteady. Your balance is off. You can't walk straight. You veer to one side or feel like you're going to fall. You need to grab onto furniture or walls for support. These symptoms might last minutes to hours, then improve, but they represent warning signs of inadequate blood flow to critical brain regions. Research published in Neurology found that dizziness and imbalance are common in people with severe carotid stenosis. Studies measuring cognitive function showed deficits in attention, processing speed, and executive function correlated with severity of carotid blockage. The mechanism involves global reduction in brain perfusion. When both carotid arteries have significant blockages, or when one is completely blocked and the other is severely narrowed, your entire brain operates in an oxygen-deprived state. Higher cognitive functions that require the most energy fail first. What makes cognitive symptoms particularly concerning is that they're often attributed to aging, dementia, or depression, rather than vascular disease. People don't connect sudden confusion to blocked arteries in their neck. This means opportunities for treatments are missed. If you or someone you know experiences sudden confusion or concentration problems, particularly if other stroke risk factors are present, insist on evaluation including carotid ultrasound to check for blockages. Early detection allows treatment before permanent brain damage occurs. Sign number 6. Sudden confusion or difficulty concentrating. Sudden changes in mental function can indicate blocked carotid arteries are causing inadequate blood flow to your brain. Here's why this happens. Your brain requires constant oxygen and glucose delivery to maintain normal function. When carotid arteries are severely blocked, overall blood flow to large areas of your brain decreases. This creates a state of chronic low oxygen that affects higher cognitive functions. You might experience sudden confusion. You don't know where you are or what you are doing. Simple tasks become confusing. You can't think clearly. Or you have severe difficulty concentrating. Your mind feels foggy. You can't focus on conversations or tasks. Reading a paragraph requires multiple attempts because you can't maintain attention. These mental changes might come on suddenly and last minutes to hours, representing TIAs affecting multiple brain regions. Or they might be more persistent, representing chronic, inadequate blood flow. Research from the Journal of Neurology, Neurosurgery, and Psychiatry found that cognitive symptoms appear frequently in people with severe carotid stenosis. Studies measuring cognitive function showed deficits in attention, processing speed, and executive function correlated with severity of carotid blockage. The mechanism involves global reduction in brain perfusion. When both carotid arteries have significant blockages, or when one is completely blocked and the other is severely narrowed, your entire brain operates in an oxygen-deprived state. Higher cognitive functions that require the most energy fail first. What makes cognitive symptoms particularly concerning is that they're often attributed to aging, dementia, or depression rather than vascular disease. People don't connect sudden confusion to blocked arteries in their neck. This means opportunities for treatment are missed. If you or someone you know experiences sudden confusion or concentration problems, particularly if other stroke risk factors are present, insist on evaluation including carotid ultrasound to check for blockages. Early detection allows treatment before permanent brain damage occurs. Sign number 5. Brief episodes of facial drooping that resolve quickly. This is the warning sign most people completely miss. Facial drooping that comes and goes represents TIAs from carotid artery disease. But because symptoms resolve quickly, people dismiss them as nothing serious. Here's why this happens. The motor cortex controlling your facial muscles receives blood from the middle cerebral artery, a major branch of the internal carotid artery. When the carotid artery is severely blocked or sends small emboli to your brain, temporary ischemia affects the motor cortex. You might notice one side of your face suddenly feels strange or weak. Looking in a mirror shows one side of your face drooping. Your smile is asymmetric, with one corner of your mouth not lifting properly. One eyelid might droop more than the other. Or someone else notices your face looks different. One side isn't moving normally when you talk or smile. These episodes might last only minutes. Your face returns to normal relatively quickly. Because symptoms resolve, people convince themselves it was nothing. They think they were just tired or maybe slept on their face wrong. Research from Stroke Journal found that brief episodes of facial drooping are significantly associated with carotid artery disease. Studies following people who reported transient facial weakness showed that approximately 40% had severe carotid stenosis requiring treatment. The mechanism involves temporary interruption of blood flow to motor areas controlling facial muscles. Small emboli from carotid plaques travel to the brain, temporarily block small arteries, then dissolve or move along. Function returns when blood flow resumes. What makes transient facial drooping so commonly missed is the brief duration. Because symptoms disappear, people don't seek medical attention. They experience it multiple times over weeks or months without ever getting evaluated. Then a major stroke occurs because the underlying carotid blockage was never discovered and treated. If you experience facial drooping, even if it resolves within minutes, this is a medical emergency. Call emergency services immediately. Don't wait to see if it happens again. Every episode of facial drooping represents your brain crying out for help, warning you that blood flow is inadequate and a major stroke may be imminent. Sign number 4. Sudden difficulty swallowing. Difficulty swallowing, called dysphagia, can indicate blocked carotid arteries are affecting blood flow to the brainstem regions controlling swallowing. Here's why this happens. Swallowing involves precise coordination of muscles in your mouth, throat, and esophagus, controlled by nerve sensors in your brainstem. When blood flow to these brainstem regions becomes inadequate from carotid disease, swallowing function becomes impaired. You might suddenly have trouble swallowing food or liquids. Food feels stuck in your throat. Liquids go down the wrong way, making you cough and choke. You might feel like something is blocking your throat, even though nothing is there. These symptoms might come on suddenly during a meal, last minutes to hours, then improve. Research published in the Journal of Stroke and Cerebral Vascular Diseases found that dysphagia appears in approximately 10% of people experiencing TIAs. Studies showed that swallowing problems often preceded major strokes affecting the brainstem. The mechanism involves ischemia to brainstem swallowing sensors. The carotid arteries connect to the vertebral arteries through the circle of Willis. When carotid blockages are severe, blood flow patterns change throughout the brain, including to the posterior circulation supplying the brainstem. What makes swallowing difficulty significant is that it's often attributed to other causes, like acid reflux, throat irritation, or esophageal problems. People see their primary care doctor or a gastroenterologist, but never get evaluated for vascular disease. The carotid blockages go undetected. If you experience sudden difficulty swallowing, particularly if accompanied by other neurological symptoms, insist on comprehensive evaluation, including assessment of your carotid arteries. Swallowing problems can be a warning sign of impending stroke requiring urgent treatment. Sign number 3. Hearing a whooshing sound in your ear. Hearing an unusual whooshing or pulsing sound in one ear can indicate turbulent blood flow through a severely blocked carotid artery. Here's why this happens. When a carotid artery becomes severely narrowed by plaque buildup, blood rushing through the tight space creates turbulent flow. This turbulence makes an audible sound called a bruit. Sometimes you can hear this sound in your own ear, particularly when lying down in a quiet room. You hear a rhythmic whooshing, pulsing, or rushing sound that matches your heartbeat. It sounds like wind blowing or water flowing. The sound is only in one ear, the side where the carotid artery is blocked. The sound is called pulsatile tinnitus. Unlike regular tinnitus, which is constant ringing or buzzing, pulsatile tinnitus pulses with each heartbeat. Research from the Journal of Vascular Surgery found that pulsatile tinnitus can be caused by carotid stenosis. Studies using ultrasound showed that approximately 20% of people reporting pulsatile tinnitus had significant carotid artery disease. The mechanism is straightforward. Turbulent flow through a narrowed artery creates vibrations. These vibrations transmit through tissues to your ear, where you perceive them as sound. What makes this symptom important is that many people never mention it to their doctor. They think it's just annoying tinnitus, or they assume it's related to their ears or sinuses. They never consider it could be coming from blocked arteries in their neck. If you hear a pulsing or whooshing sound in one ear that matches your heartbeat, tell your doctor. This symptom warrants evaluation with carotid ultrasound to check for blockages. The sound itself isn't dangerous, but it can indicate severe stenosis that puts you at high stroke risk. Sign number 2. Sudden severe headache on one side of your head. A sudden severe headache localized to one side of your head can indicate a blocked carotid artery is causing ischemia, or that a carotid artery dissection has occurred. Here's why this happens. When a carotid artery becomes acutely blocked or develops a tear in the artery wall called a dissection, it can cause sudden severe pain. The pain is typically on one side of your head, the same side as the affected artery. The headache comes on suddenly, without warning. The pain is severe, often described as the worst headache on that side. It might be accompanied by neck pain on the same side. This represents a vascular emergency. Either the artery has dissected, creating a block clot that can travel to your brain, or the artery has become acutely blocked, cutting off blood flow. Research from cephalalgia found that sudden severe unilateral headache should raise suspicion for carotid dissection or acute occlusion. Studies showed that headache appeared in approximately 60% of people with carotid dissection. The mechanism involves pain-sensitive structures in and around the artery. The artery wall contains nerve fibers. When the wall tears or stretches from blockage, these nerves send pain signals. What makes this symptom critical is that it often precedes stroke by hours or days. The dissection or acute blockage hasn't caused brain damage yet, but will if untreated. This is your warning to get immediate help. If you experience sudden severe headache on one side, particularly if accompanied by neck pain, vision changes, or any neurological symptoms, call emergency services immediately. Don't take pain medication and wait. This requires emergency imaging of your carotid arteries to check for blockages. Sign number 1. Experiencing multiple brief episodes that resolve. Taking the top position, having multiple brief episodes of any of these symptoms represents the strongest warning sign that blocked carotid arteries are about to cause a major stroke. Here's why this happens. TIAs often occur in clusters. Small pieces of plaque repeatedly break off from an unstable carotid blockage. Each time a piece breaks off and travels to your brain, you experience symptoms. As the embolus dissolves or moves along, symptoms resolve. But the underlying problem, the unstable plaque in your carotid artery, remains. You might have several episodes of weakness, vision loss, or speech difficulty over days or weeks. Each episode lasts minutes to hours, then resolves completely. You feel normal between episodes. Because you recover fully each time, you might convince yourself these episodes aren't serious. You don't seek medical attention because you feel fine now. Research from the Lancet Neurology found that people who experience multiple TIAs have extremely high short-term stroke risk. Studies showed that after experiencing 3 or more TIAs within 1 week, the risk of major stroke within 7 days exceeded 20% without treatment. The mechanism involves unstable atherosclerotic plaque. The plaque in your carotid artery has developed a soft lipid core covered by a thin fibrous cap. This cap has cracked or ruptured. Pieces of the soft core are breaking off repeatedly. Each piece causes a TIA. Eventually, a large piece will break off, causing permanent stroke, or the entire plaque may suddenly rupture and completely occlude the artery. What makes multiple TIAs the most critical warning sign is that they represent your last chance for intervention before catastrophe. Your body is screaming that stroke is imminent. The time to act is measured in hours to days, not weeks. If you experience multiple brief neurological episodes, even if each one resolves completely, call emergency services immediately. Don't wait to see how many episodes you'll have. Each episode brings you closer to permanent, devastating stroke. You need emergency evaluation and treatment to stabilize the carotid plaque before it causes irreversible brain damage. What you must do right now. If you recognize any of these warning signs in yourself or someone you love, understanding the urgency can literally save a life and prevent devastating disability. First, call emergency services immediately for any sudden neurological symptom, even if it resolves quickly. TIAs are medical emergencies requiring the same urgent response as major strokes. Calling 911 gets you to the emergency room where rapid evaluation can detect carotid disease before permanent damage occurs. Second, if you have risk factors for carotid artery disease, including smoking, high blood pressure, high cholesterol, diabetes, or family history of stroke, discuss carotid screening with your doctor. A simple ultrasound can detect blockages before they cause symptoms. The test is painless, takes 30 minutes, and could save your life. Third, if you're diagnosed with carotid stenosis, follow treatment recommendations closely. For severe blockages, surgical procedures called carotid endarterectomy or carotid stenting can remove the blockages and dramatically reduce stroke risk. Medical management includes taking antiplatelet medications like aspirin, statins to stabilize plaques, and aggressive management of blood pressure and cholesterol. Fourth, modify risk factors immediately. Stop smoking today, not tomorrow. Smoking damages artery walls and accelerates plaque formation. Control blood pressure strictly with target below 130/80. Manage diabetes with A1C below 7%. Take prescribed medications consistently. Fifth, learn the fast stroke recognition system. Face drooping, arm weakness, speech difficulty, time to call 911. If you or someone near you shows any of these signs, don't wait. Every minute counts in stroke treatment. Remember, your carotid arteries are the lifelines to your brain. When they become blocked, your brain is in immediate danger. The warning signs we've discussed represent your body's desperate attempt to tell you that something is wrong. Listen to these warnings and act immediately. Which of these warning signs surprised you most? Have you experienced any of these symptoms? Share your thoughts in the comments below, and subscribe to our channel for more life-saving information about preventing stroke and protecting your brain.